Hello people. Today we will talk about lumbar disc herniation. It is a very common problem and back pain today is also a very common problem, and there are many causes of back pain. One of them is lumbar disc herniation. So our vertebral column has many vertebrae. First, we have the cervical ones. So the cervical spine. The cervical spine has 7 vertebrae. Then we have the thoracic spine. The thoracic spine, which has 12 vertebrae. And then we come to the lumbar spine. The lumbar spine has 5 vertebrae. So the lumbar spine has 5 vertebrae. Then we have the sacrum. The sacrum are also vertebrae but fused. So the sacrum, basically fused vertebrae, 5 of them. And last but not least, the coccygeal bone. It is also 3 to 5 fused vertebrae. So about 34 vertebrae altogether. But for the purpose of this video, we want to analyze the lumbar vertebrae. So most problems with our spine, in most of the cases with the intervertebral disc, arise from the lumbar vertebrae. So more than 90% of all of these problems, prolapses, herniations, actually arise from the lumbar vertebrae. So we will take one of these normal vertebrae. So this would be a lumbar spine vertebrae, and between them is this intervertebral disc. So we will enlarge this here from a bird's eye perspective. So if we look from above, and here from the side perspective. So in this case, this would be anterior, so facing the belly, and this would be facing the back, posterior. And here, this would be anterior, facing the belly, and this would be posterior, facing actually the back, or as it is drawn here, the spinal cord and the cauda equina. So if we look here, so above the vertebrae is this vertebral disc, and this is what we are seeing here. So the vertebral disc normally looks like this and has this central part, which is called annulus, which is called, this part is called the nucleus pulposus in Latin, which basically means that it is a soft nucleus of the disc. This outer part, which looks like a ring, is called annulus pulposus. So it is basically a fibrous ring that is going around this nucleus. These so if we look here, the nucleus has a central part, and around it are these fibrous layers that compose this fibrous annulus. So basically this annulus, it enables these vertebrae to have some movement between them, and also it is an important shock absorber. Normally it sits centrally between 2 vertebrae. So this is one vertebrae, this is another, for example L4, and this is L5, and there is an intervertebral disc between them. Here this yellow part is the spinal cord. This is the anterior longitudinal ligament, and this is the posterior longitudinal ligament. So there are ligaments going on the front of our spinal cord, on the front of the vertebral column, and on the back of the vertebral column. And here is the spinal cord. So this would be the spinal cord. And from the spinal cord, there are nerve roots going out. So these are nerves going out from each side. So what happens when it comes to disc prolapse or disc herniation? So basically, over the time, because of our sedentary lifestyle mostly and other factors that can also be genetic, but imagine if we sit always and we lean forward. So this sedentary lifestyle. So when we lean forward, the pressure will be on this front part of the disc. So here. And this pressure, so if this is anterior, this is the front part of the disc, there will be always pressure here. This will push the nucleus back and stretch this part and cause stress here. There will be little tears, so there will be degeneration of this annulus, and over time, so in years and years and decades, this can break and cause this nucleus to go out. The nucleus will then push on the spinal cord and cause problems, or push on the nerve root and cause problems. So the nucleus can prolapse centrally and can collapse posterolaterally. And this one is actually the most common one, the most common problem. So if we take this and look at it in the pathological way, so from a bird's eye perspective, we see what happens. The nucleus, there is a break in the annulus because of stress of because of stress on the annulus, it breaks, and the breakage site is where the nucleus comes out. And we see that here the nucleus has actually now been pushing on the nerve root. And you can imagine if you have and this is actually a lumbar disc herniation. In this case, the hernia site of the nucleus pushes on the nerve root and causes problem. So in this case, you would have severe, for example, if it is lumbar, leg pain and severe back pain. If we look at it from the side perspective, we see that from the side perspective, the height of the discus has changed. You can see that also on X-ray films, that the intervertebral disc space has narrowed. The disc has degenerated. The nucleus is pushed posteriorly, and it herniated. You see how this hernia can also, so it can push on the nerve root if it is herniated posterolaterally, but if it is herniated centrally, it can push on the spinal cord and cause also problems there. So there are a few variants in order to come to this problem. So first, one of the variants is a simple bulge. So normally we see that in the normal case, the nucleus is located centrally and the annulus is around it. But when there is stress, when there is degeneration, a part of the disc degenerates and there a little bulge is created. So this is called disc bulging. And this is, for example, the first stage you would have. From this, we would go to prolapse. So when the annulus is still intact, but there is a part of the nucleus and a part of the annulus that is pushing on the nerve root, but this is still intact. The outer layer is still intact. This is called prolapse. So disc prolapse. And from the prolapse, once the stress is too great on the annulus, it breaks and the nucleus comes out. This is called herniation. And when the herniation lasts for some time, a part of the nucleus can degenerate further and they can break off from the main body, and this is called sequestration. So these are all possibilities. The difference between bulging and prolapse is that the annulus is complete. There is no breakage, but in herniation, lumbar disc herniation and sequestration, there is a breakage and the nucleus comes out. So the big problem with this is that most of these patients will have back pain, and most of them will have leg pain. So the big problem, as we can see, is pain. The pain can be in various degrees and cause various degrees of problems and limitations in the patient. The treatment for this is obviously pain medicine, and one important is physical therapy. So these two, pain medicine and physical therapy, can actually help very much, especially if there is not too much destruction and degeneration already happening. Once these conservative methods fail, the only way to treat it is surgery. Also, one very important point is so there is this term called the cauda equina syndrome. Basically, if the prolapse pushes too fast and too hard on the spinal cord and the cauda equina, it can cause acute problems like pain in the groin area, pain in the gluteal area, loss of bladder control, and loss of stool control. And this is a medical emergency, and it needs to be treated with operation immediately. So this is a medical emergency. All other cases can be debated, but cauda equina syndrome needs to be addressed as an acute problem and a medical emergency. So obviously, this is one topic and one theme that many people have experienced. If not a prolapse in the herniated disc, then at least pain, back pain. And back pain has many differential diagnoses. Even if we have lumbar prolapse, even if the pain will be in the back area, so here in the back area, there will be pain. The pain, if there is push on the nerve root, will be in the dermatome the nerve is supplying. So for example, if it is L5, then it will go around the leg into your big toe. So, but it doesn't need to. It can also be only on the upper part of the leg. You can feel the pain. Also, you can feel the pain in the hip area. So sometimes it is also important to analyze other joints, for example, the sacroiliac joint or the hip joint, to see maybe they give the pain. Maybe there is coxarthrosis or degeneration of the hip joint. So it is very important to analyze the patient before, and of course, the most important thing to actually have a proof that it is that this is a problem, that the patient has a problem with the lumbar spine, is to do MRI. So MRI is the golden standard to diagnose this problem. Thank you for listening.